So you've done the pelvic floor PT, you've tried the dilators, the creams, all the expert advice. You've even tried communicating better or just relaxing, and still your body experiences pain or it shuts down the moment that intimacy comes on the table. It's exhausting, it's discouraging, and it's just overall incredibly challenging to deal with. So that's what we're talking about today, the missing piece in your healing process of overcoming vulvodynia or any other chronic pelvic pain conditions. You're not the only one that's feeling stuck, even after taking all of the experts' advice. I've seen this in my clients again and again, and I experienced it myself. My name is Kayna Cassard. I'm a sex therapist, a pelvic pain mental health coach, and I dealt with vulvodynia and vaginismus for over a decade. And here's the thing that I didn't know back then. When the tissue is healthy, but sex still hurts, it's not just the body that we're dealing with. It's a protective pattern that the body has just overlooked, and we haven't been given the right tools to rewire the brain so that it doesn't continue to anticipate pain or disconnection or guilt or any of the emotional pain that comes with painful sex. So if you've had pain with penetration for over 6 months, then it's considered a chronic case of vulvodynia or whatever pelvic pain diagnosis that you might have. So if you've been doing all of the things that doctors have recommended, and if your tissue is technically healthy, that means that the flight or fight system can keep sounding the alarm. Your body isn't sabotaging you, it's just trying to protect you. The problem is it can't tell the difference between actual danger and the memory of pain or discomfort that you've experienced in the past. So it prepares you for pain even when there isn't a danger present. But your pain is real. Let's not go down the route that a lot of healthcare providers do where they dismiss the pain that is truly being felt in your body. So it is real, and it is something that is sounding the alarms of the flight or fight system that you actually have a lot more control over than you realize. So let's talk about how pain can be a brain pattern. So over time, your brain learns a shortcut, and the shortcut is touch equals danger or intimacy equals danger. And then that activates the pain response. Even gentle, well-intentioned intimacy can feel threatening, not because it is, but your system has practiced that intimacy or touch has created a pain association over and over again. It's like having a super sensitive alarm in your house or apartment that goes off every time you boil water. There's not really a danger, but the alarm system is set to such a sensitive level that it detects even steam as being something dangerous. And so this is why traditional approaches or approaches that don't integrate the mind-body connection and teaching you how to do that fall short in treatment. So all of these treatments can be really helpful, but they might not be enough to help the everyday experience of engaging in intimacy again. So for instance, one of the first ones is physical therapy and dilator work. They're great in clinical settings, but when it comes to real life intimacy, there's unpredictability, there's more pressure, there's a lot more emotional complexity to have to also integrate into the intimate experience that you don't get practice in a clinical setting. So your flight or fight system is going to still sound the alarm, even if you can use a dilator that's the same size as your partner without pain or without much discomfort. So the other component is medications or topical treatments, and those can help with tissue irritation and inflammation and teaching some of the nerve to calm down. However, they don't teach your body and your overall system how to feel safe when you're now suddenly in those situations that feel like there's a lot of pressure riding on them. So talk therapy or relationship advice can help make sense of things. But if your body still goes into a bit of panic when it comes to touch or intimacy, then logic isn't going to be enough. These aren't bad tools, they're just incomplete. They don't teach your body how to stop responding to intimacy like it's a threat. So you likely have been told what to do, take your time, stretch, breathe. No one showed you how to actually calm your body's danger response when things start to feel intimate. You haven't been taught how to get your body into a neutral place. And that's a moment where you're not necessarily feeling pleasure, but you're also not feeling pressure. And that's the step that everyone skips, and it's the step that makes the rest of this possible. So if you're wondering how to even start calming your body's reaction to intimacy, I made a free resource for you. It's called Soothing Intimate Pain, and it kind of starts to give a little bit of a roadmap of what we're talking about here. So if you want to check that out, you can go to kaynacassard.com/soothing pain, or you can find the link below as well. So the goal in moving forward is to teach your body how to experience neutrality around sex and intimacy, which I know feels totally counterintuitive, but I promise you it works. It's really important not to force or hope for pleasure when you've been experiencing pain for so long, going from 0 or -10, 12, 50 to 60, where pleasure is at, that's going to just be way too big of a jump. We need to start small, start at 0 at neutral, and then do small steps moving upwards. So healing from vulvodynia or other chronic pelvic pain conditions isn't about pushing through, having date nights, and just trying harder to enjoy sex. It starts by teaching that your body doesn't have to be on high alert anytime the topic of sex comes up or someone tries to get close to you. Your body needs to learn that it's safe enough to not brace. It needs to find that neutral place. And this is the work that I do every day, creating simple, structured ways to approach intimacy so the body can actually relax instead of constantly bracing for or anticipating pain. In the next video, I'm going to talk about the one mindset shift that every single one of my clients needed to have in order to overcome their pain. It's the shift that helps them stop second guessing at what the next movement is forward and start taking those steps forward with confidence and clarity. So if you've ever thought, why can't I figure this out when I've already tried everything? Then don't miss the next video, check it out, and I'll see you there.